The global death toll from the coronavirus pandemic keeps on rising. Is there any end in sight? Hello, I'm Arnold Neidem, and this is The Heat. It has been another deadly day across the world as countries try to beat back the COVID-19 pandemic. The number of reported cases is now more than 1.5 million, and the death toll is over 87,000. The United States remains one of the hardest hit countries with over 14,000 deaths. Meanwhile, there is some good news. Wuhan, China continues to open up after a 76-day lockdown, and people are starting to travel again. Our panel will discuss all the major developments in a few minutes, but we begin with Dr. Tom Frieden. I talked with him earlier that he is the former director of the Centers for Disease Control and Prevention. Dr. Frieden, thanks so much for joining us.
Thank you.
There are now more than 400,000 coronavirus cases in the United States. Thousands of people have died. How much worse is this going to get? Could we see the spread from one hot spot to another?
Unfortunately, it is going to get worse before it gets better. And the tragic scenes we're having in New York City today could be replicated elsewhere in the country unless communities really do shelter in place to flatten the curve so you don't see this kind of explosive spread.
How concerned are you about the availability of things like ICU beds, ventilators, protective equipment that hospitals and medics need so badly right now?
The whole point of sheltering in place is to avoid the kind of overwhelming situation which really no city in the world would be able to withstand. It's tragic to see so many healthcare workers becoming infected, so many patients dying, and this really is a warning to every city anywhere in the world to take this very, very seriously.
Do you get the sense that people are abiding by these guidelines? Because we still see people going to church, we see people going to the beach, going to parks. We even had an election, in-person voting taking place in Wisconsin.
One of the real challenges of responding to coronavirus is to get your mind wrapped around how incredibly quickly this can explode. In New York City, the virus was doubling every 2 days. And if the city hadn't sheltered in place for another 2 days, the number of people who will die from this would have been double what it is now.
Do you think that there should be some kind of legally enforceable lockdown that would force people to stay home?
What we must do is work with communities, engage communities, figure out what works. There are real needs. People have to eat. People have to go to work if they're in essential jobs. They have to travel. So the key is to use data and information to do smart sheltering in place so that we minimize the societal disruption while we maximize the public health benefit. But we also need to keep a second thing very clearly in mind. It's not just about flattening the curve. It's not just about sheltering in place. It's about preparing our systems to test, isolate, contact trace, and quarantine so that when cases do begin to come down, we can keep them in a constrained box and not have this kind of explosive spread again.
Based on what we're seeing right now, do you think that we heard numbers of 100,000 people to 200,000 people could die from the disease, but looking at what we have now, is it likely that that number could be a lot lower?
Any number is too many. The point here is not to have some macabre guessing game about how many people will die, but to work urgently right now to make that number as low as possible.
Is there any way that the federal government, the White House for that matter, could impose some kind of national guideline that all states should follow?
I think we need much clearer standard guidance from the federal government, science-based, with our lead public health agency, the Centers for Disease Control and Prevention, guiding the response to say, this is what needs to be done. This is when we need to shelter in place. This is when we can start coming out again and gradually opening the tap on doing that. And if there are areas that don't, the likelihood is that they will have excess deaths. And if they continue to have spread, what we're seeing around the world is countries that are controlling it are saying to people from countries that haven't controlled it, stay out, or if you come in, you're going to need to quarantine for 14 days when you first arrive. That's the kind of thing we could see within countries as well as among countries.
Dr. Frieden, what we are seeing in the United States and in other parts of the world as well, that many of those, in fact most of those I think, who are dying actually have an underlying illness, and in many cases it's a pretty serious illness. But are healthy people also vulnerable?
Absolutely. There were a few real misconceptions early on. One was that 80% of people have only mild illness. In fact, about 40% seem to have mild illness. Another 40% have a really nasty viral pneumonia but don't need to be hospitalized. The other 20% end up in hospital. Another real and dangerous misconception is, and kind of a horrid one if you think about the ethics of this, oh, it's only old and sick people. First off, that's an atrocious perspective, and second, it's wrong. It is true that the death rate increases rapidly with age, and it is true that people who have underlying health conditions are more vulnerable, but it's also killing young, healthy people. And remember, in a place like the United States, 40% of our population have at least 2 chronic conditions. So it's not a few very ill people, it is millions, in fact, more than 100 million Americans who are quite vulnerable.
It's a very bleak picture, but there is one little glimmer of hope, and that comes from the city of Wuhan in China. There was a 76-day lockdown there. What is your assessment of the measures that China took to fight COVID-19 and get it under control?
China has become something that an experience of that people are really trying to understand. There's a lot of controversy about China in the news these days. We have a unique perspective at Resolve to Save Lives. We have an office registered in China officially. We're active there on a variety of health issues, and I have staff there who've been tracking it daily and understanding. And there's certainly a lot that China could have done differently and better in the past, but there's an enormous amount to learn from. China has put into place an extraordinarily proactive, focused public health approach, and with that, they are able to get back out again. And that's what every community in the world needs to do. It's 4 key things: testing, isolation, contact tracing, and quarantine. If you do those 4 things really well, you can allow people to begin to go out into the open again and reopen your society. If you don't, you're going to see it rage through.
What are the practical lessons that other countries can take away from the Chinese approach and strategy in dealing with the pandemic?
In addition to the widespread testing, one thing that we're looking at closely is the extraordinary effort of contact tracing. The city of Wuhan, with 11 million people, had 9,000 people, 1,800 teams of 5, doing contact tracing. For the United States as a whole, that would be the equivalent of an army of 300,000 contact tracers. That's the kind of effort we need. It's something like a 100-fold increase in the strength of our public health system. But if we want to move forward, we need to do that.
You know, we talked about the people who are most vulnerable, elderly people. There is concern about elderly people in nursing homes. What can be done to protect them there?
Nursing homes, as I said early on, are really the ground zero for this virus. It's the perfect storm of a congregate facility, highly vulnerable people, and lots of shared space, shared food, shared utensils, things that move around from room to room like trays. We really have to look very, very carefully, stop all non-essential visits, test all residents and staff for the virus, cohort any who are infected in one place, dramatically improve the way we clean in those areas, make sure that anyone who becomes sick is immediately isolated. And with that, we have seen some communities, even some senior communities, able to prevent an outbreak from occurring.
The homeless are also another very vulnerable group, especially in a big city like Los Angeles, but we see that in other cities in the United States and around the world as well. What is the best way of preventing the spread of the coronavirus in a vulnerable community like the homeless?
Any infectious disease control in homeless populations is very challenging because of the combination of homelessness and sometimes mental illness and substance abuse. One of the things that some cities are doing is ensuring that any homeless person who is ill is provided a place to stay that's safe. They can also provide places for those who've been exposed and work in facilities for the homeless, shelters or soup kitchens, to ensure that you're minimizing the potential for exposure and infection.
There's been a lot of debate over the kinds of drugs that can be used to fight COVID-19. Is there anything that you have learned since we last talked, that was about 2 weeks ago, that gives you hope for a more effective treatment and possibly even a vaccine at some point?
We're learning more all the time. As of now, there is no proven treatment for COVID-19. We're learning some more details about how patients can be best managed in the intensive care unit. The importance of supplemental oxygen is becoming very clear. The possibility of avoiding intubation and ventilator use in some patients if enough oxygen is given. And some approach to having to support patients through their illness, understanding that except in rare circumstances, steroid treatment is probably not helpful. We need studies done quickly to understand whether the promising treatments that are there actually work. Once we know that, then we can focus on getting them to the people that can benefit most from them.
Doctor, even when the United States and other countries get this under control, how concerned are you about something that we hear very often these days, and that is a second wave of infections?
We really have to get our conception clear. Sheltering in place has two reasons. One is to flatten the curve so we don't overwhelm our health and public health systems. But the second is to prepare for the day when we come out again. It's not going to be some magical thing where we can all come out safely because it's all clear. It's not going to be all clear. It's going to still be a risky time. And that's why we have to ready our system to test widely, trace contacts, isolate those who are ill, and quarantine those who are exposed. By doing that, we have the potential to gradually open the tap so we can come out more safely and as soon as possible, while we still might need to have the most vulnerable among us, the older people and people with severe underlying conditions, shelter in place for longer.
Dr. Tom Frieden, thanks so much for joining us, sir.
Thank you.
And there is much more to discuss. With us now from Washington, D.C. is Joseph Williams. He is a senior news editor with U.S. News and World Report. With us too via Skype from Washington is Gavin Macgregor-Skinner. He is an infectious diseases expert. And joining us from Beijing by Skype is Victor Gao. He's a Chinese international relations expert and commentator. Welcome to all of you. Gavin, let me start with you. Right here in the United States, you know, we see one hotspot and then we see another hotspot. The death toll is now over 14,000. What is your assessment of where we are right now? And is the peak still to come?
We still are dealing with a new novel virus that we really don't know how each individual's immune system is going to react when we get infected. So again, mapping the number of cases, the numerator, the people that have been either diagnosed or have shown symptoms, and then looking at the denominator, all those people that haven't had symptoms, haven't been sick, and that denominator number is in the millions. And what we need to do now at the neighborhood level is be able to take all those actions, practices, and information that we have to ensure that we protect those that haven't been exposed to the virus, keep them healthy, but then understand what will happen as Dr. Frieden said, as we start to relax some of these restrictions on physical distancing, staying at home, and what would happen as, again, with so many of us have not been exposed to this virus, what's going to happen? Is it a second wave, a third wave, or a fourth wave? And there are things that we can do through modeling.
Gavin, what kind of tracking system is being used in the United States? You know, Dr. Frieden was talking about the city of Wuhan in China, where they had hundreds of thousands of people carrying out tracking. Is that being done here as well?
It is in certain states, counties, wards, neighborhoods. Again, it has to be more consistent. Cell phones are ubiquitous. People are using text messaging, video conferencing, ways to share information. But then what I do see in some neighborhoods throughout the country, they're making fantastic neighborhood maps. They're showing where there are highly vulnerable people, high-risk people, based on underlying conditions or their age or any other situation. They're showing where areas of where people or families had to be isolated, and those then help neighbors helping neighbors. So again, we've got to take this down to the local neighborhood level to protect the vulnerable, but to protect everyone else that still hasn't been exposed to the coronavirus.
Joseph Williams, we're getting more and more data as the days go by, and one of the things we're getting right now is a breakdown by race on the people being infected here in the United States, and we're beginning to see that large numbers of African Americans are being infected, large numbers of African Americans are dying as well. Why are African Americans suffering so disproportionately?
Where do we begin? I mean, basically, this is social determinants of health laid bare. These are problems that have been hidden in plain sight. It goes anywhere from underlying conditions such as disproportionately high rates of diabetes, heart disease, cancer, obesity, all the way up to lack of access to physicians, suspicion of physicians because of longstanding problems in our medical system, to implicit bias in some in the healthcare industry, to jobs that tend to not have paid sick leave, also for public-facing jobs that don't allow you to work from home. Think about bus drivers, say, or someone in the retail industry. These are all factors that kind of combine, and we haven't even begun to talk about housing, about density, and about the fact that most of African American communities in cities are concentrated in very small spaces. So there are an untold number of reasons why this is a problem, but this is the first time in the United States that we are seeing the social determinants of health and the underlying disparities inherent in that system laid bare in real time.
So these disparities were already there, Joseph. I mean, we hear a lot of criticism of the healthcare system in the United States, that it's very unfair, that it doesn't cover everyone, and we're seeing the very ugly legacy of that, aren't we?
Yes, we really are. And the problem that we're facing is that even some places are not counting by race. They're not categorizing their data by race. The CDC, the central arbiter of a lot of this, is not tracking race, and that's a big problem. There have been several congressional committees that have asked the CDC to do this. There have been independent doctors, organizations that have asked them to do this to get a bigger picture of the problem. New York would just only today started categorizing by race, and what they found was astonishing, that people of color are getting hit significantly harder. And it's incumbent to have that data going forward so we can find out where we've been and how to address these problems once we're out of this.
Okay, let's go to Beijing and bring in Victor Gar. Victor Gar, Wuhan is now reopened after a 76-day lockdown. People are on the move again. What's the mood in China right now?
I think in China there's a mixed feeling. On the one hand, everyone is very happy to see the lifting of the lockdown in Wuhan. It's a great triumph for the people in Wuhan who have suffered so much, endured so much, and made such a contribution for the rest of the country and the rest of the world, because they did their part in preventing the widespread of the virus. On the other hand, I think China is in a very vigilant state. No one is complacent. Everyone is still on the alert, because we now face the menace of the imported infection cases, as well as the possibility of another recurrence of the virus. And also this asymptomatic coronavirus problem is also a new problem that the scientists, the doctors, etc., need to deal with. And the policy is that we want to reopen the economy gradually in a controlled way, but no one should be complacent. Everyone stands ready for this virus.
Victor, this fear that there could be a second outbreak, what kind of precautions are the authorities in China taking to track this, to make sure that people are clear of the virus completely?
Absolutely. I think the former head of the CDC just now mentioned in very eloquent terms about the right measures that many governments and all countries need to think about adopting. China probably is doing the best in this regard. And even though the lockdown or the quarantine in many parts of the country are gradually being lifted, many of the institutions and mechanisms and methods and the social setups enforcing the lockdown still remain in place, and the government need to do a very fine-tuned job as to how much tightness they need to apply to these mechanisms in case there is a recurrence. And this is why China is more or less faced with an unprecedented dilemma. On the one hand, we want to lift all these restrictions, prohibitions, for example, but on the other hand, the country cannot wait. We need to gradually go back to normalcy. Everyone needs to go back to their job, for example. Schools eventually need to be opened. At the present, China is at this very important and sensitive, delicate tipping point, one way or another. We want to have the best of the two worlds. We want to contain the virus on the one hand, save people, make sure that people no longer suffer from the panic. On the other hand, we want to go back to normalcy. We want to have all the factories, businesses reopen,
Right.
and the country is back to the normal.
Gavin, you know, if we look at a map of the United States of where the coronavirus is, we see, you know, these sort of red spots all over the place, but they're very high concentrations in urban areas like New York, like New Orleans, and in the past few days we've also been seeing a very high concentration in Atlanta, in Georgia. How concerned are you that this could spread to the rural areas, and would they be prepared to take on something like this?
Yes, well, again, the way we have to understand the dynamics of the transmission of the coronavirus that causes COVID-19, you have to have pretty close contact with someone that has the virus that may probably have symptoms, although we have seen some patients without that spread the virus without having asymptomatic, or that is having no symptoms. But the concern here is that as it moves out of the urban areas, the high density areas, into the rural areas, the lower density areas, I'm seeing better preparation of those areas. But again, there's one big missing piece of this puzzle that we haven't solved yet, and that's the way to deliver the essential information that's required for every US citizen to protect themselves from getting infected. And the way we're doing that now is through English. It's through websites with lots of words where you have to read lots of things and understand. And we're not catering for all those Americans that don't have English as their first language, that may not be able to read. And we need to change our tactics and the way that we deliver this information, which is so important to protect people from getting infected.
Very quickly, Gavin, how would you recommend those tactics be changed?
Again, you know, I work in a hospital, and we have translation services in the hospital, you know, for over 20 languages on a daily basis. The challenge I'm seeing now from the federal government, even some of the state governments, although that is changing, still too much of this information is being delivered in English, and still too much reliance on someone searching the internet, finding the appropriate website, being able to read that information, interpret it, and then actually take it to action and do something to protect themselves, to protect their loved ones and their neighbors. That's got to change. Videos are much better. You know, people learn by doing. They learn by seeing. They learn by being, you know, seeing something visual.
Joseph, you know, Victor Gao told us a moment ago that when we look at Wuhan and the fact that it's reopening right now, one of the dilemmas that the Chinese authorities face is how do we reopen big cities like Wuhan, how do we open big provinces like Hubei province, and make sure that there isn't a second outbreak. That's a dilemma facing the United States as well, isn't it? I mean, we hear that most often from the president himself. Do we have any idea of when that could happen? The president has said that his guidelines will go until the end of this month. Do you think it's going to be pushed even further down the road?
It's really hard to say whether or not we will be able to open on that timeline. Honestly, it's day by day, month by month, week by week, because as long as we still have infection rates skyrocketing, and as long as we have people who are dying by the hundreds every day across the nation, it's obviously way too early. The president has his agenda, but the virus has its. And I firmly believe that the virus will have the last word. Until then, all we have to do is what we need to do and stay in and try to control it. If we don't do that, it's going to take even longer than it already is right now.
Right, I think that was something that Dr. Anthony Fauci did say, that it's the virus that will determine the timeline here. Joseph, one other thing, and that is, you know, there's a lot of anxiety in many places in the country over people losing their jobs. We know that. There was a stimulus package that was passed. There's now serious talk of another package being passed as well as an infrastructure bill, which would do something for jobs in the country. Do we see that happening in the next few weeks?
Yeah, absolutely. Nancy Pelosi and her team have already put their heads together and tried to figure out what to do. They've been talking with the administration to settle on a number. Already some people in the administration are saying that more needs to be done to get small businesses back on their feet, because 56% of all Americans are employed by small businesses. So that's a really hard number to reach with just stimulus alone, just handing people checks alone. Business needs to be looked after here, small businesses particularly, and I would not be surprised to see another package come out within the next 2-3 weeks at the earliest.
Okay, Victor, I want to talk about another country, and that is Japan. It's just declared a state of emergency. It appears to have taken the Japanese government quite a long time to do this. Is it too little, too late?
I hope not. I think Japan previously was faced with a dilemma about what to do with the Summer Olympics. But now the decision has been made to postpone it to next year. I think Japan had more liberty and freedom to decide what to do in terms of directly facing off this menace from COVID-19. And I think Japan, given the nature of a small island country, very large population, very high population density, and also a senior aged people account for a very large percentage in the country as a whole. I think Japan is in a very, very delicate and dangerous position. If the government does not become more assertive and proactive, it probably will be worse before it gets better. So I wish all the best to the Japanese people in this fight against the coronavirus.
Gavin, I was talking to Dr. Frieden earlier about some of the most vulnerable groups, talking about people in nursing homes, talking about the homeless. In the past day or two, we've been getting information that there's been a major outbreak of the coronavirus in Cook County Prison in Chicago. There are 353 cases there. That's both staff and prisoners. And given America's overcrowded and often very unsanitary prisons, is this a ticking time bomb?
It's a very big concern for any organization, any facility that has a lot of crowding, whether it be a prison, a nursing home, an assisted living, or any other facility. And again, I work and help a lot of these facilities come up with plans all the time to develop different zones within those facilities, zones where we may be able to keep the disease or the virus out, and zones where we know the virus is already there. Yeah. And again, I want to emphasize that why this is a big concern. This is also, the coronavirus is an envelope virus. It's the easiest of all the germs to kill or inactivate through proper cleaning and disinfection.
Right.
And so again, when we see this big explosion, this huge increase in cases of people within these buildings, these facilities with high population density, we have to go back to first principles, clean and disinfect and kill the virus.
We have run out of time. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for being with us.